And thank you, Jim. Thank you very much to you and David, all the others, for organizing today. What I'm going to present or discuss with you is a view of how or why or when or if digital health literacy will be a determinant for empowering patients and empowering people. And my background for discussing this is I have worked as a medical doctor formerly, and I have started using health technology, being interested in it already in 1981. I have worked with interest of education for almost 35 years. And for the last 10 to 12 years, I have worked in innovation and informatics. And what I'm going to present today is my colleagues, collaborators, and my research group's material findings, thoughts around the concept of e-health literacy or digital health literacy. And what is e-health literacy? And today I have this subscript, digital health literacy. Originally, e-health literacy was proposed by Norman and Skinner in 2006 as a concept of a way to people's ability to find, understand, appraise information got from the internet information, and then with their ability to use it for a particular matter in relation to their health. So it was very much like the original concept of health literacy. It's a way to find and appraise information, and here the context is the technology or the internet at that time, and it was for a specific condition. This concept has been challenged since by many, from Professor van der Waart from the Netherlands and later on from others as well. And today we have approximately 5 or 6 different concepts or instruments to evaluate and measure e-health literacy or digital health literacy. The reason I use these words synonymously is that I am aware that digital health is a broader concept which also covers genomic, proteomic, and things like that. But if we are talking in a person-related or people-related context, then I take this opportunity to make these words synonymous today. My engagement in digital health literacy came in particular in 2010, where I got a PhD student, Ole Nørgaard, that started research in this field and very fast identified a huge resource in Professor Richard Osborne at that time from Melbourne University, today Swinburne University. And we started a collaboration around developing a new concept of e-health literacy. And Ole, and in particular Richard, together with Ole, they worked in a co-creative manner, interviewing and making co-productive sessions, both in Denmark and UK, and Ole identified 450 statements given by professionals, patients, their relatives, both in primary and secondary healthcare sector, and also policymakers, researchers. And then he condensed them into 7, turned it into these 7 dimensions into 3 major themes. One is the capacity of individuals, the other is trust and motivation, and the third part is the experience. And this resulted in the e-health literacy framework. Here, the first part is the user's capacity or knowledge and skills. And 3 dimensions here, which are important, is the ability to engage with information, which means that people are able to understand health-related information and take interactions and use it in conversations. And the second one is the concept of the health, understanding their health condition. And the third one is the ability to engage with digital services. So it's actually in these 3 parts here, knowledge and skills, is very similar to Norman Skinner's original concept. The second part here is the trust and motivation, where he identified that it's important to feel safe and control in how your data are handled by the professionals and where they are, and that you can trust that they're not coming to other people.
And also it's important that it's beneficial. There's a motivation for you to use the technology, and the way you work together with the health professionals, you can actually benefit from having technology available in your communication and interaction with the health professionals. And here at the last one, the experiences, it's important that you experience that you have digital systems that work together, that your data are available to both you and the professionals whenever you need them. If you suffer from something, that you're able to see your health condition data, related data from your personal health records, and your health professionals, when they go to them, can see data from all the sectors, and the systems will be up and running whenever you need them. And the seventh one is that it suits your needs. The next slide here just shows all the 7 dimensions in total. And actually, these 7 dimensions were informed us in a process where we developed a questionnaire, the eHealth Literacy Questionnaire, which is an instrument with 7 scales, 1 scale for each of these 7 dimensions, which enable us to evaluate, assess, and evaluate people's digital health literacy or eHealth literacy from these 7 dimensions. And what I'm going to present now is very shortly data from 4 different projects, where 3 of them are published in international peer-reviewed journals. And the first one here is the results from a early study on outpatients in a medical clinic, and they are ranging from the age of 18 up to 90 plus. And what you could see here in 2015-16, at that time, 5% of the population in this outpatient clinic were not using a national digital identifier, but 95% were using it. And just for those of you who think, oh, maybe it has changed after this corona situation, then I can tell you that the number is approximately the same today. Also, we could see that 57% of them engaged with a doctor, general practitioners through digital sources, mainly email, and 54% used the national health portal, DK. These numbers have maybe increased a little over the last years, but actually the number of users of the National Health Portal, if you do not take into account the users for looking into your corona status and vaccination status, then is not that different today from that time. But the important message here is that when you look into these persons, then you can see that the usage of the National Health Portal and the national identifier, in particular, the National Health Portal did not relate to age, gender, education, or self-reported health, which it does for people not affiliated with the healthcare sector, but people involved with the healthcare sectors. Here we can see there are no differences in these determinants. Whereas if we look into our 7 dimensions of eHealth literacy, we can see that for 6 of the 7, except for the feeling safe and in control of where data are, then the users of the National Health Portal will have a higher level of eHealth literacy than those being non-users. And for those using the National Person Identifier, we can see that also 6 of the 7, but now it's the only one not being different between users and non-users is actually the understanding of your health, the concepts of the health and languages. And that is maybe obvious, or maybe not obvious, but it makes reason that it's not related. The health part is not related when you're using National Personal Identifier, which is used in a lot of contexts. So the important information here is that normal considered determinants like education, self-reported health in this population was not significant, whereas eHealth literacy could help us to understand. And these data probably suggest that the level of eHealth literacy may be a predictor of the likelihood to adopt and be a sustainable user of a system like the National eHealth Portal. Another study was in pregnant women,
both of Danish origin, but also descendants of migrants and non-Western migrants, and also non-Western migrants, as well as Western migrants. And again, we applied the e-health literacy questionnaire to 450 women. And the interesting part was that when we saw the data for most of the dimensions or scales, there were a lower level amongst the migrants compared to those with Danish descendants. But when we corrected or adjusted for educational status, it was only in EHLQ3, which is about the ability to engage with technology or digital services. There was a difference, which meant that those with Danish origin, they had a higher level of a small higher level. It was not very much, but it was a significant higher level of e-health literacy. So there may be a difference between those that belongs to that group compared to the migrant groups with relation to the technology and digital services. Interestingly, we found that, again, using the national ID, we also have access to a national mailbox where you get all the information from the health services. And here, 30% of those being migrants, they were exempted from this service, whereas it was only 1%, less than 1% of those with Danish origin. So that is a challenge. And the interesting part here, again, is that there was a difference in the level of e-health literacy in relation to ability to engage with information, understanding of language, concepts and language, ability to engage with information and feeling safe and control. But when we again adjusted for education, again, it was only the EHLQ3 which signified a difference between those being migrants and those with Danish origin. So here we are informed that often it is considered that people being new in society may have some challenges. And here the understanding of digital health literacy help us to understand that it is not that different, and most of the differences can be explained by differences in education. The two first studies I mentioned are published and can be found. The third here is from a Danish survey, which is performed every 4 years. And this is from Region Zealand, which is one of 5 regions in Denmark with 800,000 inhabitants. And of these 800,000, 2.5% is invited to fill in a very huge questionnaire about their health condition and related conditions. And we got data around e-health literacy in relation to 3 of our scales, which is the HLQ1, ability to engage with information and feeling safe and controlled, force, and the motivation. And our respondents were 17,000, which means it was approximately 80% of those invited. And it was gathered both by online questionnaires, but also by mail for those not being digital. And this was done in the January, February of 2021 in the second wave of Corona, at a time where a lot of people were using digital services in Denmark to get access to their Corona status. And despite of that, we can see that those answering here, this is from age of 18 years and up, it is approximately 1/3 that did not have a satisfactory level of digital health literacy in relation to the ability to find information and being motivated to use digital services. Maybe a little unexpected for people outside Denmark, Scandinavia, it was less than 1/5 that actually had concerns about how the data were stored and how health professionals use the data. So that there's a less proportion that are worried about that. The interesting part here else is that people about the age of 65 years, there's 60% that has a satisfactory level in relation to 1 and 5, and it's 50% about the age of 85% that has a satisfactory level. So said in another way, when we people increase in age in the standard population, then it's 40% and up to 50% that does not have a satisfactory level in relation to these areas, in contrast to feeling safe and controlled, where people, in the oldest people about the age of 80, you can see it's less aware to them about how their data are stored. So people are less of concern in relation to that. So these data here suggests that even though that we in Denmark consider ourselves to be relatively digitalized, then is a relative high proportion of the population that have a not satisfactory level, and we really need to address this population, part of the population, in how we can help them to engage better with information, and also how we can better motivate them and demonstrate to them which benefits there are in the different health services. The last one I'm presenting here is also a published study. This fourth part here is just published here in April, and it looked into health professionals that were introduced to a new electronic health record system, and we assessed their level of e-health literacy before and after the introduction of the electronic health record. The interesting part here is that the medical doctors has the highest score in relation to the knowledge and skills, the HLQ 1 and 3. Actually, they have a very low, much lower score in relation to 6 and 7, which is the experiences with systems. But the important thing here is that both the doctors and the other groups, nurses, nursing assistants, and medical secretaries, we found in relation to the ability to engage with information that around 1/3 of them, even amongst the doctors, had a not satisfactory level. So it is very important when we are doing interventions in education, also for health professionals, to be aware of that there's a relative high group that have challenges in relation to how to engage with information in a technological or digital service context. And this is actually in accordance with findings from Australia. And the other thing was that during the implementation of the electronic health record, in particular those older and with a lower education, like medical secretaries and nursing assistants, they had a lower level of e-health literacy after the implementation, probably due to feeling challenged by the introduction of the system. Finally, we were able to see that the overall motivation actually declined a little over time after the introduction of electronic health record. So the implementation of the electronic record actually indicate our data indicates that the introduction of electronic health record may not have been experienced as beneficial for them, at least not for the first 3 months after implementation. So the main message from this part here is that the health professionals are supposed to be those to motivate and engage the patients and citizens, but we need to be aware of that for maybe 1/5 to 1/3 of the health professionals also have challenges and may not be the best ambassadors before we are able to actually meet them and educate them to facilitate, and also in a way where we can convince them that technology and digital services are beneficial both for themselves and for their patients or their citizens or their clients. So what I have introduced to you here is the introduction of the e-health literacy framework, the e-health literacy questionnaire as instruments to understand different populations, both professionals and different populations. And if we are able to understand these different areas, which can be barriers or which can be of concerns, then we may be able to better design the implementation and introduction of technologies. So that was my message. Thank you very much for listening, those of you who remained here, and over to you, Jim.